Hello, welcome to my YouTube channel. Today, I'm gonna talk about the urinary tract infection in pregnancy. I did a video of urinary tract infection and the differences between the urinary tract infection and the sexually transmitted infection. Kindly find it and watch to get more of the information. I told you this is the channel where you learn medicine and you get to gain knowledge of health issues at your home. Now, today I'm gonna talk about the urinary tract infection in pregnancy. The main issue is to prevent this urinary tract infection so as to avoid the complications that may arise from this UTI. Urinary tract infections are just bacterial infections that affect the urinary tract system that consists of the what we call the urethra, the bladder, the kidneys, and even the ureter. So this is what we call the urinary tract infections. They are not sexually transmitted. The other thing is that they are very most common in pregnancy, and this is because 1 out of 10 women may have urinary tract infection. The other thing is that mostly is caused by the E. coli. The E. coli is a bacteria that is naturally just in the anus, the colon, and even the rectum. So therefore, most of the time, this E. coli is the one that causes this urinary tract infection. The other thing is that the urinary tract infection, they are preventable and also they are treatable. It can be of lower urinary tract infection that consists of the urethra, or the upper urinary tract infection that now affect the kidneys and even the urethra. Now, what are some of the or what we call the risk factors of this urinary tract infection? One is to get this E. coli, which is an organism in the anus and also in the colon and the rectum. Uh, One is that the women sometimes they wipe themselves from front, from back to what we call front. This may lead to what we call the urinary tract infection because of this E. coli migration to the vagina and even to the urinary tract infection, that is the urethra and all the way to the bladder. The other thing is short urethra. Women have short urethra, therefore the distance for this bacteria is very short also. The other thing is that during pregnancy there is hormonal changes. This may expose one to have these urinary tract infections. The other thing is women who are with what we call the low immunity, maybe diabetes and all other conditions. This may also expose one to have urinary tract infection. The other thing is what we call the consumption of sugar. This also too much consumption of sugar. This may lead to what we call the overgrowth of some yeast infections, hence the other bacteria, which is the normal flora, can also die, leading to what we call this urinary tract infection and all other yeast infections. The other thing is vaginal douching. This is also a risk factor of this urinary tract infection. Now, on treatments, one need to go to the hospital if she has the complaints of raw abdominal pains, uh, just burning sensation during urination, also what we call an urgency or frequency in urination. The other thing is what we call if there is smelly urine and what we call the fevers. So one needs to go to the hospital for this if she has these signs and symptoms for a checkup, to do a urine checkup and to get the right treatment of these bacterial infections. So on prevention, again, women need to observe the hygiene by wiping themselves from front to back to avoid this E. coli migration. The other thing is always urinate frequently. Don't hold your urine. If you have a feeling of urination, just urinate to avoid much holding of these bacteria. And the other thing is wearing of cotton underwears, or just what we call the panties, to absorb this moisture and also to make sure that the environment is also good. The other thing is to avoid vaginal dodging and avoid high consumption of this sugar. So this is the urinary tract infection in pregnancy. The main issue to prevent this is to avoid the complications that may arise to the mother and the unborn baby. So this is the end of this video. Kindly, if you are new, remember to subscribe. Remember to share this information, and also remember to comment so that we can continue making these health videos. Thank you very much.